All right, for anyone who is joining us from the waiting room, thank you so much for joining us tonight. We're excited to get started. While we are waiting just to get started in a couple of minutes, please take a second to fill out our sign-in sheet. We're going to use this to keep track of everybody who's joined us and sort of reach out after the event to see whether or not we can help you with some of the information that we provided tonight. All right, looks like we are all set to get started. So hello, everyone. Welcome to our Legislative Advocacy, What It Takes to Make Change event. We're so excited to have you here. My name is Maddie Wren. I am AMSA's Education and Advocacy Fellow for the year. So I am just sort of introducing everybody. And while we're getting started and while we're adding everybody in from the waiting room, please take a second to just fill out our sign-in sheet. We're going to use this to keep track of everybody who's attended our event. So without further ado, again, welcome to our Legislative Advocacy event, and I will hand it off to Ali.
Thank you so much, Maddie. Welcome, everyone. My name is Ali, and I'm serving as your president for this year. I want to thank you all for taking out the time for joining us here on this Thursday evening. And I also want to give a special thank you to both of our speakers for joining us here as well. This year's been full of challenges. We've had overhaul to medical education, bless you, a raging pandemic that is still not under control. We've had frontline workers and trainees who've been left to fight without crucial tools, assaults on science and public health, a national reckoning for racial injustice, and threats to the very fabric of our democracy. But despite these challenges, we're currently standing poised for change at this time. And now at the end of a very long year, and with the promise of a new government, we're anticipating both the start of the incoming administration and the start of the 117th session of Congress. That's why we themed this event on legislative advocacy, to get the perspective from that of an advocacy group that has succeeded in passing bills into law, and to get the perspective of a Senate staff member who has worked with stakeholders in advancing health priorities. So before concluding this event, we'll provide resources and next steps to help foster relationships, especially between student campuses and the offices of their elected officials. And with us here today at this event, we have two incredible speakers. First, from RISE, we have Justin Hatmaker, who is the Chief Operating Officer. And we have, following Justin, Brian Kaplan from the Office of Senator Tammy Baldwin. So we'll begin here from some remarks from Justin. We'll follow with some questions there. Justin is the CEO of RISE. He's a veteran of Democratic politics, and he's worked on campaigns in 11 states throughout his career. He worked on President Barack Obama's 2008 primary and the general election campaigns, and then went on to serve for nearly the entirety of the Obama administration at the United States Department of Agriculture, where his work focused primarily on business development, increasing investments in renewable energy, and combating poverty in rural communities. Justin is a proud Ohioan and a graduate from the Miami University in Oxford, Ohio. Justin, thank you so much for joining us here today. I'll hand this over to you.
Great. Thank you, Ali, and to the rest of the team for organizing this event and for inviting us to join you tonight. I want to quickly apologize for the late change. I know some of you may have been expecting Amanda Wynn, our CEO, to be here tonight. Unfortunately, she could not make it, but she sends her regards. And I'm very, very excited for the opportunity to get to speak with you all, in particular, the opportunity to speak to young people who are not yet jaded and cynical about the world, like a lot of folks that are in politics that I work with oftentimes. And I also just want to take a moment to recognize your all's contributions, the medical community's contributions during this pandemic. I want to thank you all for choosing a very selfless profession that, if it hasn't already, at some point will put you on the front line. So thank you all for your work. So as Ali said, my name is Justin Hatmaker. I work for RISE. We're a national nonprofit organization that advocates for sexual assault survivors and trains advocates to pass legislation in their home state. To date, RISE has passed 32 laws in total. 29 of those are survivors' rights bills across 25 states, the District of Columbia. And it's our goal to pass a sexual assault survivors' bill of rights in every state across the country. We're also currently working on introducing a resolution in the United Nations General Assembly that would establish survivors' rights as a global issue. I want to start tonight by talking about some of the challenges of advocacy, and I can start with the reason that we're all on a Zoom call tonight and not together in a lecture hall or a meeting room. COVID has presented us with a variety of challenges, many of which we're still figuring out and learning about and beginning to understand. My hair is a great example. I haven't had a haircut since February, and it's starting to become a problem. Ali's nodding his head, but it's really thrown a wrench into our work and legislative action more broadly. The challenges that COVID presents to advocacy really mirror the societal challenges that we've seen. The lack of face-to-face conversations, the inability to attend events and go see people in person, things that are important to us being canceled or postponed. In our case, it's entire legislative sessions being canceled or postponed in states. And just generally the attention being fixated on the pandemic response and everything else that has gone into how the virus has impacted this country. For us, we were very optimistic about 2020. We had 10 bills introduced across the country by the time COVID hit. 9 of those bills were immediately put into jeopardy by COVID when those legislatures shut down. One state did happen to just power through and get our bill passed early on, which we were very excited for. But ultimately, only 2 came back to finish the work and get our bills passed. So all said, we got 3 bills passed in the middle of a global pandemic, which is something that we're very proud of. But in a year that we expected that number to be much higher, it's somewhat of a disappointment. But we totally understand. We know that states and legislatures were doing everything that they should, closing down and following all the early stay-at-home orders and whatnot. So we're trying to recover now, and we're looking forward to a hopefully, knock on wood, really productive 2021. But COVID is really just one of many challenges that organizers and advocates face. There are unique challenges based on which jurisdiction you're working in, whether it's the state or local or federal level. RISE focuses mostly on state legislation, so I'm going to talk about that, and I know I'm excited to hear from one of our friends on the federal side here in a minute. But we started as an organization by passing a federal sexual assault survivors bill of rights in 2016, and that was passed unanimously through Congress and signed into law by Barack Obama in 2016. But that bill doesn't cover all survivors of sexual assault. Most sexual assaults are adjudicated in state court, so the laws that apply to survivors are really dependent upon the state in which the assault takes place. And of course, each one of those states has a different set of laws. So that's why we're working to try to pass a bill in all 50 states so that all survivors in the country have access to the same rights. And we're halfway there and looking forward to hopefully getting all the way there at some point. But what that means for us is that we're working with 50 different sets of rules in legislatures across the country, 51 if you count DC, and I certainly do, being a resident of DC. But every state does things differently. Fundamentally, the way a bill becomes a law is the same, in state legislatures, but every state has different definitions. They use different terminology. They have different processes, different calendars, different written rules, different unwritten rules. Everything is really different and unique to each state. So we have to be prepared to make tweaks and adjustments to our approach in every state that we're working in. We also have to find ways to get people who are busy with a number of other issues, COVID response, for example, to listen, care, and then act. People are generally supportive of the general idea of providing rights to sexual assault survivors. And most of our rights are so common sense that people are sometimes surprised to hear that they don't already exist. I myself have been surprised to hear that some of our rights don't exist. Prior to us passing a bill in New York, the state of New York destroyed rape kits after 30 days. And we had to pass a bill to change that. Prior to our bill passing in several states, there wasn't even a requirement to test the kits in the first place. So we had to pass bills to change that. But understanding or supporting a cause doesn't always necessarily translate into interest in the work it takes to sponsor a bill and usher that bill through the process. So even if you can find people to listen, we've got to convince them to do the work for us. And that can be tricky as an outsider. As I mentioned, we're DC based, but we train local volunteers across the country to do this work and pass bills in their state. That's a fundamental aspect of our model and how we operate. But even the local volunteers in those states are outsiders to the legislature that can be seen as coming in and trying to tell a group of people how to do their job and what they should prioritize and how they should do things. It would be like me walking into a hospital and telling a surgeon that I know what I'm talking about, and that patient over there definitely needs a myocardial revascularization. And I practiced that a lot, and hopefully I got it right. Myocardial revascularization. The surgeon would say, "No way, get out of here. This is my job. I know what I'm doing. I don't need your help." And it's really the same thing. So what it boils down to is that we need to find ways to connect with members of legislatures and demonstrate to them why they need to pass the bill in their state and what benefit there is to them and to their constituents. And fundamentally why they need to listen to a bunch of outsiders. So we've been pretty successful to this point for a number of reasons. As I mentioned, we passed bills in 25 states and the District of Columbia. But the first reason that we've been successful is that we have really dedicated advocates. I work with some of the most passionate, dedicated people I've ever known. These are volunteers that have worked on bills for 2, 3, 4 years in a row until it gets done. These are volunteers that work in states that have a legislature that only meets for a couple of months every other year. These are volunteers that are repeatedly told no and ignored by committee chairs that won't even read their emails, but they bounce back and persevere because of their dedication. And we've also had the privilege of working with some really wonderful sponsors around the country that have gone to the mat for our bill, even in the face of obstruction and indifference. So each time we pass a bill, I'm reminded that passion and dedication are really the most important resources that we have as advocates for these rights. We know we'll get the bills done. It's really just a matter of time, and it really just takes the right people to do it, both from our side as staff and volunteers and in the legislatures. The next reason is that we stay informed. We know the rules, we know the people, and we know how to play the game. Literally just yesterday, we were just barely able to avoid disaster in Oklahoma. We were running up against a deadline to request bills, which is tomorrow. We didn't have a sponsor that was prepared to request the bill, and missing that deadline would have ended our chances for the entire year in Oklahoma. But because we knew the deadline, because we knew who was involved, who was in the legislature and what they're about, because we knew what was needed by the deadline and how we needed to go about approaching getting this done, we were able to identify a senator that was able to step in and help us. And we got the bill requested today. So we're thrilled about that. But that preparation and attention to detail and really constantly reviewing and researching every state's rules, players, calendars, all the things that are unique to each state, that's what's given us a chance in so many states. And the last reason that we're successful is because of how we chose to address our issues. It's how we approach advocacy. We were very pragmatic when we drafted our model legislation. We looked to accomplish what we felt would be beneficial to survivors, but also that had a very good chance to pass. And almost all of our laws have passed unanimously. I can only think of 2 that come to mind that weren't unanimous. And it's because our bill is nonpartisan, non-controversial, and it doesn't cost money. And we occasionally get pushback on the contents of the bill itself, but it's usually when we do get pushback, it's because of the process or time or perceived cost or some other kind of restraint that's not related to the contents or the fundamental nature of the right. But the ability to go to both Democrats and Republicans and demonstrate that the bill is nonpartisan, non-controversial, and doesn't cost money is really the main reason that we're successful in what we do and that we're able to work in any and every state in any given year. So I know that not all issues and organizations are going to have that luxury. Not everybody can take the same approach and have that non-controversial or nonpartisan bill. Some bills need to be partisan. Some issues are a little bit more ideologically driven than sexual assault is. Our issue tends to be something that everyone can agree needs to be addressed in certain ways. But it's still a challenging thing. Advocacy is hard, and it's still an uphill battle for us, even working in an issue that is so kind of universally accepted as needing work. But it is really the dedication to the issue that makes the difference, and it's the reward that comes from seeing a bill signed into law and the people that benefit from it that makes it worth it. So thanks for your time, and thanks for giving me the chance to speak tonight.
Absolutely. Well, thank you so much, Justin. I know there's still a lot more work to do, but first, congratulations on all your success so far. And
thank you.
Generally from a value standpoint, many of us in the healthcare community and medical community, certainly here at AMSA, are also supportive of all the work that's going on there at RISE. You talked about sort of the three different counterparts for how you've been advancing bills, having dedicated advocates, staying informed, and your approach to advocacy. I was wondering if you could go maybe perhaps a little deeper into, especially when you describe playing the game, what tools have been useful to you and for RISE in order to build that power and influence to affect change?
Yeah, I think it really, it boils down to taking the time to learn the playing field that you're working in. If you want to kind of boil it down to just one state, and most of our volunteers do focus on just that one state, and hopefully our volunteers only have to go through it one cycle. But as I mentioned, a lot of our volunteers do end up having to come back several years in a row because they just can't get traction. But when you just focus on the one state, making sure that you know what you're looking for, and this is something that we constantly are learning new things about states. We're constantly learning new deadlines or new procedural ways that can obstruct our bills. So it's really kind of knowing what to look for, how to find it, and especially not trusting the internet, because state legislature websites are notoriously bad at updating their information, and they have a lot of outdated stuff up there. But I think it's really the first step is knowing what you're looking for and knowing why you're looking for it, and staying updated on what that is. And it all, organizing, it boils down to communication and connections with people. I think the best way that we are able to sell what we're trying to do, and that's really what advocacy is. You're selling something, is to make a connection with the folks that you're talking to. So when we meet with potential sponsors in a state, we want to know everything about them. We want to know what they care about. We want to know other bills that they've sponsored. I'll give you an example going back to Oklahoma from yesterday. The senator that requested our bill has been really big on law enforcement over the years. He sponsored a lot of bills that have supported law enforcement. And part of our bill does go towards making law enforcement's job easier in criminal cases of sexual assault, and we talk that up when it's something that's important to sponsors. So I really think kind of knowing your audience and knowing how to connect with them and demonstrating why your product that you're selling is something that they should buy is the key.
Thanks, Justin. You touched upon this a little bit already, and earlier you had said rightfully that advocacy is hard work. So when you're thinking about your organizing methods, what practices have been successful and what have not?
Successful in?
Overall, it would be overall objective of trying to work with staff or elected officials to advance these bills.
Yeah, I think it again goes back to communication and connection. It's also persistence. We find ourselves in positions where we have to make decisions about where we're at a dead end. When we're kind of faced with deadlines coming up and we have a potential sponsor who's kind of on the fence, we really want to invest in that potential sponsor, but not to the end of kind of losing the opportunity to get the bill passed. And I'm sorry to keep going back to the same example, but that's what put us where we are in Oklahoma. We just kind of ran out of time with some folks who we've worked with before and who are wonderful advocates, but that just couldn't commit to it. And it's not that we had to kind of cut ties with them, but we had to decide to go a different route. So I think, it's persistence. It's, kind of knowing when it's time to change course. and certainly learning from your mistakes. I've been with Rise now for this is my third year with Rise, and every cycle I learned something different. I learned something new, and I learned something that will help me in the future, either something particular about a state or something just in general. And again, I know not everyone, every advocate in every position is going to have that luxury, and not everyone is going to be working in 10, 15 states every year. But certainly kind of doing your best to learn from both your mistakes and your successes can be beneficial.
Thank you. And then last question over here. You were talking before about having dedicated advocates. So for people who feel like they do not have experience in advocacy, or how do you expand your coalition, especially when you're dealing with volunteer advocates? And you mentioned going through a volunteer training program. What tips do you offer them to help them become effective advocates when they're engaging with staff and officials?
Yeah, and I'll tell you that most of our volunteers that come to us have zero experience in advocacy. A lot of them don't even really know much about the legislature. They may be completely removed from politics altogether. We don't consider ourselves to be a political organization. We're somewhat apolitical, even though we work in politics. But a lot of folks really are starting from scratch, and we do have to train them. I think knowing that one person is able to make change is really important in this work. And for us, that's really the only reason that we are where we are today. Our founder, Amanda, was one person that started a movement that got a bill passed unanimously through Congress and then started in states. And it started to kind of grow from there. And when one person in Washington State sees another person in Massachusetts get a bill passed through Congress, pretty much by themselves, it has the potential to really inspire them to do what I think everyone is told to disregard. People say only one person can't make a difference. Well, you can, and we go out of our way to make sure that our volunteers know that if they put in the time and if they work with us, we'll get them to the point where they pass a bill. And it is very much their bills. We like I said, our model is that we give volunteers the tools to go do the work. On certain occasions, it's staff doing the work, but most of our bills were passed because the volunteers put in the time and the effort and the energy on the ground. They were the ones talking to the sponsors. They were the ones negotiating the bills language. They're the ones testifying in committee hearings. And the only way that a person can be confident, I think, in that kind of situation is by showing them how many other people have done it. So, we now have 26 states where we can say, look, someone else did that. So for the remaining 24 states, there is someone that can do that. You just have to find the right mix of kind of blind optimism and passion for the issue.
Absolutely, and that's certainly a testament to the power of just even one person and organizing advocacy overall. Well, thank you so much for sharing all that with us, Justin. Next, we're going to get the perspective from someone who works in the Senate and works with advocacy groups and stakeholders. With us today, we have Brian Kaplan. He's a legislative correspondent and an aide for the Office of Senator Tammy Baldwin, where he supports her health, nutrition, and low-income policy agenda on the Senate Committee on Health, Education, Labor, and Pensions, and the Appropriations Subcommittee on Labor and Health and Human Services. Previously, Brian was a health policy fellow for the Health Committee, a ranking member, Senator Patty Murray, and his committee policy portfolio included commercial health insurance, drug pricing, substance use disorder issues, and reproductive health. Prior to his work in the U.S. Senate, he conducted research on the ACA marketplaces at the Kaiser Family Foundation, and he served as a clinical manager and outreach director for a volunteer-run free clinic in the San Francisco Bay Area. Brian received his bachelor's degree in public health and his master's degree in health policy management from Stanford University. Brian, thank you so much for joining us here today.
Thank you so much for having me. It's definitely a pleasure to be here and to share some perspective from the federal level. Definitely learned a lot from Justin's presentation on state level advocacy. And I also want to give a shout out to all the med students on the call. I have a lot of friends who are med students or finishing up med school, including Ali, and I have a ton of empathy for all the work you put in and for the future efforts on your end to work in healthcare profession. So thank you, and bravo to you.
Thank you so much, Brian. So Brian, we heard a little bit from Justin about how one of the focuses there is writing bills and seeing them through to passage. When you're dealing with stakeholders and advocacy groups, what other opportunities do you see for advocates when you're meeting with them?
Absolutely, and there are so many opportunities for advocates and stakeholders and constituents in particular to really make a difference in the legislative process. I think oftentimes, as is the case with RISE, some of the best ideas and some of the best new ideas really come from the stories of individuals who experience a problem and really take it to the legislative process at every step of the way. To give another example beyond RISE, in our office, we heard from a constituent, a young patient who basically had a pretty rare craniofacial abnormality, and his insurance basically wouldn't cover it even under the ACA because they viewed it as a cosmetic procedure, even though this is something that was really impacting his day-to-day well-being. So that was something that our office had not come across before, really hadn't made its way to Congress in the past. And we worked with him, and he's 13, and his mother every step of the way. And now this bill is on the cusp of passage, which really will close a loophole that allows insurance companies to deny care to essential medical procedures like that. So really every step of the way, there's an opportunity to get involved, to present new ideas, and just to really make a difference. And maybe I'll share one more example. I think bringing new ideas is really important, but also really beating the drum and driving important issues home is helpful at every step of the legislative process. I think maybe to give one example, I'm going to be full of examples today, so sorry about that. But another example is I'm currently working on an issue that is, I can't share too much about, but is related to a lot of mental health and substance use crises we're seeing that have really spiked as a result of the COVID-19 pandemic, just because of stay at home and increased stress across the board. And the particular policy that Senator Baldwin, who I work for, is looking at, and that we've trying to drive home, is something that usually Republicans would not join us, and usually tends to be a little bit more partisan. So we have used patient stories and constituent stories every step of the way to really target specific offices and bring up kind of the other half of the piece of the puzzle, which is so important to actually getting this policy across the finish line. And now again, it looks like it potentially will make its way into a future COVID relief package if we get one across the finish line. But really every step of the way, there's a lot of opportunity.
Thank you, Brian. You mentioned beating the drum is also part of the long, hard work that is oftentimes required. And you're just talking about the power of those personal stories. When you're meeting with different stakeholders and advocacy groups, what do you see as some of the most successful meetings, and what are some of the practices taking place that maybe aren't so successful?
Absolutely. So some of the best meetings I take, and I, at this point, have taken many, many hundreds of meetings. I think something that I'll point out is that a lot of meetings surprisingly happen not on just kind of typical legislation, but happen on the appropriations side of things. Ali mentioned that my boss, Senator Baldwin, she sits on the Appropriations Committee, which is the committee that ends up funding the entire government. And a lot of amendments kind of make their way into that process, and they end up even being more on the policy making side as opposed to just funding different programs. And that's really must pass legislation. So everyone kind of wants to get their priorities into that particular bill because as we all know, as we follow the news, sometimes it's really difficult for Congress to move things that aren't must pass. And even so, we experience a government shutdown from time to time because we don't pass government funding either. So really a lot of the meetings that we end up taking are on the funding side and stakeholders pushing for important patient priorities on that front. But to really talk about what a successful meeting looks like, it's very clear that an advocate cares about an issue, is really passionate about it, has done their homework, has a good pitch prepared, a really powerful personal story that connects to the particular issue. And they understand that the person on the other side, the person taking the meeting, which oftentimes the first point of contact is a staff member like me, as opposed to a member of Congress or a senator, cares about these issues, has probably a reasonable grasp of these issues and wants to be as helpful as possible. I think some things that I've seen work a little bit poorly is at the outset of certain meetings, I think folks might assume that we might not know what we're talking about as staffers, or we don't care about a particular issue. I think it's safe to give background, but I definitely had a doctor at one point just explain to me very slowly what an electronic health record is. And it was after a few years of working on health policy, and it was definitely not a good way to start the meeting. And another example is another constituent group kind of starting a meeting by saying, oh, well, we're here to talk about maternal mortality, but you're just a young male staffer and you probably don't care that much. And that's definitely not true, and something I definitely prioritize and care deeply about. And B, I don't just speak for myself. I speak for my boss, Senator Baldwin, who cares very much about these issues and has been driving them forward for a very long time. So kind of across the board, just assuming positive intent and making it as easy as possible for us to really dive into the issues, go into maybe my substantive questions or questions on your perspective without spending the whole time maybe talking about just the very high level background view that maybe you think I don't have. Yeah, I'll stop there.
Yeah, no, thank you so much for sharing that. I'm especially thinking about the landscape of so many different stakeholders and advocacy groups, like you were just mentioning, having to take hundreds and hundreds of meetings. Do you have any tips for fostering those sustainable and engaging relationships, especially given you have so many different groups with so many different issues that they present?
Yeah, absolutely. I think really across the board, I would again just point out that us in our roles, we do take a lot of these meetings, and oftentimes they are crunched together at very particular points of the year. There's kind of as Justin mentioned, there's a legislative calendar that it's hard to really see into unless you're working on it every day. But there's several fly-in seasons where a lot of groups end up pushing all their meetings together. So it's tough to really parse out, what are my takeaways from one meeting when I have 8 meetings with different groups in a day, or what is my homework assignment from one meeting that I said I do. So to that point, I'd say building long-term relationships, really connecting with me after the fact, and doing some follow-up, I think is always good. I think there's definitely there's definitely a limit that's a little bit annoying, but I would say in general, it's very, very helpful to follow up, to ask me questions about how I view the items that we talked about, whether I had the chance to present it to the senator, things of that nature. I think it's helpful to be a little bit annoying, and you'd be surprised. I think in general, I might have a really good meeting with a group, but then there's no follow-up, or maybe the follow-up is just a quick thank you email. So I would say that to really, really drive an issue home, to stand out, please follow up with me. Please make my life just a little bit miserable, and I'll be so much more likely to drive the issue forward, just because there's so much that's competing with our time, not because I don't want to, not because I don't care.
That's great to know. Thanks for sharing that, Brian. We talked a little bit about the large landscape of stakeholders, and then when we hone in specifically on healthcare, that also is still pretty vast. From your perspective, what value do you see in physicians in training as in their roles in advocating for health-related issues?
Yeah, well, I think in particular, AMSA plays such an important role in the healthcare advocacy ecosystem. I very much view you guys as, and correctly, as future healthcare providers with a really important perspective to provide. And I think that's about the practice of medicine today. I think AMSA and medical students and young health providers have played such an important role in driving the AMA, for example, and other physician societies to really take bold stances and to change maybe some of their older, less forward-thinking approaches. And I think that is really to be commended. I think, for example, the AMA recently updated its perspective on single-payer healthcare and really bolstered its health disparities lobbying. And a lot of that is due to the work of young med students. And so that's incredibly important. And that kind of between group advocacy is incredibly important. So I very much urge you all to stay involved and keep doing the important work you're doing. But in particular, hearing from medical students who are just as plugged into the healthcare system as providers, but who have very much the perspective of young people who are active and engaged, so important. And beyond that, I think you all can speak to a lot of what we call kind of pipeline issues really effectively. Issues with loan repayment programs like the National Health Service Corps, or disparities in specialty pay and how that's shaping up what you consider to be the residency programs you apply to. Really things of that sort that only you can uniquely comment on, I think is such a valuable perspective for AMSA.
Thanks so much, Brian. And then last question here, and just because we have you here, we just want to know, do you have any hot takes about any upcoming COVID relief package, or even looking out to the exciting opportunities of the new administration, any opportunities that you're looking forward to with regard to health reform or healthcare in general?
Yeah, well, I think in terms of COVID relief, I was just talking to the folks right before the call started. Who knows? I think we've seen just the tremendous need that is out there as a result of the COVID pandemic. We need government assistance. We need increased funding for vaccines and for contact tracing and for public health response. We need increased food security assistance. We need so many things. And unfortunately, we're all probably following the same news alerts and reading the same things on Facebook. And there's just been a tremendous intransigence on the part of certain congressional leaders, like Mitch McConnell in particular, to really push these important relief packages forward. And at this point, if you were to ask me, I'd say it's probably 50-50 that we end up getting COVID relief by the end of the year. Basically, every day is different and confusing and happens way above my pay grade, but definitely hoping that we try and match the scale of need that's out there. And then on a brighter note, looking forward to definitely a new administration coming in, and the fate of the Senate is actually still in flux. We're waiting on 2 Senate races in Georgia to decide who leads the Senate, Democrats or Republicans. I don't want to get partisan here, but the Biden administration could do a lot with a Democratic Senate. So encouraging everyone to phone bank or do whatever. But okay, partisan hat off. I think there's a lot that can be done by the incoming administration on the regulatory side to really bolster assistance, healthcare, food security, just so many different things really on day one. And I'm really excited to see very much a robust, comprehensive approach to the pandemic that's rooted in science, rooted in data, public health decision-making, just from day one on January 20th. So that's something that we're all very much looking forward to.
Thank you, Brian. Just one more question that just came in through one of the messages. I'm personally not well versed with social media, but it is the talk of the town these days. Do you have any tips on engaging with the office of your elected officials via social media, or versus direct interaction with staff members like yourself?
Yeah, that's a good question. I am also not a huge social media person, so I don't know that I can answer that with any particular fluency or intelligence. But I would say, as many ways as you can engage with an office on an issue that you care about is definitely a good thing. Those often go to an office's communications director or digital media manager, folks like that, and they will then bug legislative staff about a tweet they got or a Facebook comment in a different way. So as many ways as possible as you can get kind of that information to us, I think fantastic. And I think to that point about engaging with an office, this year's obviously been challenging across the board. And one way that we've seen a lot of youth engagement has been through online petitions. In particular, there's been a lot of petitions after the Black Lives Matter protests this past summer, just focused on racial justice. And those are very important and a great kind of entry point for folks to get involved. What I will say is it unfortunately is a little bit easy for offices to kind of aggregate all those petitions and not and view them as kind of a number of people writing in. And that ends up not being quite as powerful as people sharing very tailored messages about what an issue might mean to them. So to the extent that you have been active maybe on the petition writing front, I would really encourage you to write in to just the general email address that offices have for your representatives, and maybe have a more tailored message, maybe call in, maybe find our legislative staffers' emails online and reach out to us directly. I think that definitely helps get the message across. And it's not fair, I think, to measure passion about an issue with how customized the message is, but it definitely gets folks' attention a little bit more. So I recommend that a bit.
Thank you so much, Brian. And thank you so much, Justin, for taking out the time and speaking with us. We're going to go ahead and shift over here to the last segment of our session here today, which is now that we've gotten the perspective, from an organization like RISE, and hearing from a Senate staff member like Brian to talk about what next steps and what resources we can provide in anticipation of the start of the next Congress. So we'll turn this over to Maddie.
Yeah, just as we transition over, again, thank you so much, Justin and Brian, for sharing your experiences with us. It's been really wonderful for us to get the chance to learn from you. So just before we transition over, we wanted to launch a quick poll so that we got an idea of what's going on in the room. So we are asking, what is your level of experience in meeting with elected officials? So have you never, ever spoken to an elected official before, or do you meet with them like every week, get coffee with them, best friends with them, all that good stuff. So looks like we have about half of our respondents. We're about, a third of the way there.
And also elected officials, it also means meeting with the offices of your elected officials.
Yes.
Right.
All right, I will close out the poll and I'll share the results with everyone. So it looks like roughly half of our participants have actually met with elected officials multiple times. So coming at this with plenty of experience. So that's awesome to hear. And with that, I will stop sharing, and Ali, I will kick it over to you.
Absolutely. Well, so, we've heard a lot about, what are the different practices and why advocacy, which is so hard, and why it's so important. And Brian touched upon this a little bit before. What is the value add that medical students provide, and future physicians in training provide, and why should we be advocating? And there's a couple of reasons for that. One, like we talked about, the landscape of healthcare advocates and stakeholders is pretty large. But as future providers, like Brian was saying, everything that's related to health is in our lane and falls within our jurisdiction. And so when we're thinking about the future of healthcare, we can begin advocating for that now. And when you think about the definition of health, it's not just the absence of disease or infirmity, but overall social, physical, and mental well-being. That means health is interconnected to a lot of different policy jurisdictions. Another reason why it's crucial for us to become effective advocates as future physicians is that if you're encouraging advocacy early, and now can lead to continued and sustained advocacy later throughout our careers, throughout in practicing medicine, or even if you decide not to practice medicine. It's advocacy that can seep into your everyday life and advocating for your patient, or advocating for structural changes within your hospital or clinical setting, all the way to advocating for policies. A final reason why this becomes so important is because this is another thing that Brian was touching upon, but young physicians, medical students are the conscious of the house of medicine. So for the future of health and the future of our patients, it almost becomes imperative for us to be able to take the tools necessary to begin advancing the priorities that we care about. So one of the things that we hope to do, and this is something that Justin was touching upon, making sure you do your homework and being aware of the legislative calendar. We have a new Congress starting in January. So that means there'll be a lot of different opportunities to be able to engage. And we want to make sure that we encourage all of the different campuses to form delegations to be able to reach out to their representatives or senators and their state elected officials, so that once you have established relationships at all those levels, and you're taking some of the tips that Brian was talking about in not just conveying your passion, but trying to be as helpful and useful as possible, that hopefully those sustained relationships can result in effective advancing of the priorities that we care about, that'll be taking place over the course of the next few months and next few years. So with that, there's a couple of resources that we do want to provide to you. I'm going to turn this back over to Maddie, who's going to go over them with you.
Yeah, awesome. Thanks, Ali. And thank you for sort of giving us a bit of perspective about why we actually should be doing this, why AMSA members and why medical students and pre-medical students should be advocating and participating in civic engagement. So I really appreciate that perspective. So let's get to the nuts and bolts of our evening. I'm actually going to share a couple of links in the chat for all of you to take a look at. So our first resource that we're going to share with you tonight is actually a state health indicator spreadsheet that we have been working on, sort of a way to provide us with some resources when we're sort of walking into these conversations with our elected officials, providing us with some numbers, some facts that can drive our advocacy and can drive our perspective. So I'm going to share my screen. Of course, you can totally feel free to open up the links that I've shared, but I'm going to just walk through our documents. If I can get my screen to share, we'll see. Okay. Can y'all see my screen? Perfect. All right. So this is our state health indicator, a document that we're just going to walk you through very, very briefly. So we have one for each state. Somebody shout out a state that you're in, your favorite state. Somebody shout.
Maryland.
Maryland. Awesome. Let's go to Maryland. Whoever that was, thank you for participating without any warning whatsoever. All right. I hope that everybody's getting a chance to open these up, but so we're looking at Maryland and we're looking at a couple of statistics that we can use to sort of motivate our advocacy. We have our sort of overall US health ranking, which has been compiled by an initiative by the APHA or the Association, the American Public Health Association. So that's out of 50. Maryland looks like it's in the 18th rank. And if you're interested in learning a little bit more about what that rank actually means, you can go down to the bottom of this sheet and click the first footnote, and that'll take you to the document. So you'll be able to take a look at sort of what statistics went into delivering that. We also have life expectancy at birth, infant death and maternal mortality as measures of outcome for health, percentage of the population that's covered by Medicaid and CHIP, so sort of access to healthcare covered in that question. We also wanted to make sure that we included some conversation about COVID-19 because that's, of course, one of the most important things that we could be talking about right now. So we have confirmed COVID-19 cases by state per 1 million population. And we have the percentage uninsured, and we have the percentage of folks who've changed their prescription drugs because of cost within the past year. So again, getting to that question of access. So why are we providing this material for you to use? I think when we think about having a conversation with an elected official, we want to think about sort of evidence-based policy that we're advocating for. And we want to be able to walk in with some conversation starters to say, this is how our state is faring. And as future health professionals, we want to ensure the health and the well-being of our future patients. And so let's look at some of the numbers of what this looks like on a sort of more statistical based level. So this is our document. And then the second document that we shared is actually just an Excel spreadsheet of all of this data compiled. So we did red, yellow, and green as a way of measuring sort of the best third, the middle third, and the bottom third of those statistics. So if you want to be able to walk in and say, hey, Maryland is doing, not so great compared to other states, and we need to think about how we can improve access to medicine, then we can use this document as well. So that's sort of what we've provided there. So feel free to use this. We're going to also put this on our website, but it's an opportunity to really dig into some numbers, which I know as medical students we're all into. So with that, I'm going to stop sharing my screen if I can figure out how to do it. Does anyone have any questions about what information we just provided? Give it a couple of seconds. All right, so no questions have come in. That's okay. Well, we are going to move on to some of the kind of next steps that we can take walking out of this conversation. we are going to be looking at sort of a worksheet that we can use to get started on our meetings with our elected officials. So if you, as about 50% of our participants have said, if you feel like you are an old pro, you don't really need to figure out how to set up a meeting with a staff member or an elected official, that's totally okay. So I just want to share very, very briefly what our worksheet provides. So Ali provided the link. You can open that up and I will share my screen again. If I can figure out how to do it. All right. So this is our legislative advocacy worksheet. I would recommend anybody who wants to use this, just copy this document and use it at your leisure. We wanted to sort of start off with the basics, figuring out what congressional district you're in. So if you're someone who hasn't interacted too much with your elected officials, this would be a great place to start, figuring out based off of your school and based off of where you currently reside, you can figure out what your congressional district is. We've provided the link right here that can get you there. And from there, you can figure out who your senators, your 2 senators and your representative are. We would, if we had enough time, we'd probably break out and have everybody who was in each state figure out exactly who their representative and senator was, but we will skip over that for now. The main thing that I wanted to mention is we want to sort of walk out of this conversation with the next steps for meeting with staff members from our elected officials' offices. So that means that we need to figure out who they are. We need to figure out how to get in contact with them, and we need to figure out how best we can walk into the room to have a good conversation and to form these sort of long-lasting relationships that we've been talking about throughout this conversation. So with that, would recommend really using this document, writing down who your elected officials are, what website you might need to use to schedule an appointment with them, or what email you can use to schedule an appointment with them. So that's why we have our scheduling template right here that you are more than welcome to use. So reach out to the scheduler. And you know, unfortunately, I'm running out of time, so I won't spend too much time on this, but really take a second to take a look through our worksheet. We talk through some of the next steps, talk through some of the ideas that you should always keep in mind, how to build that delegation of medical students before you actually attend a meeting, and think through some of the talking points that you want to consider talking about. If you think that the COVID-19 relief package is the most important thing that you could be talking about right now, then figure it out just based off of some of the ideas that we have on our worksheet, a couple of stories that you think that you could share, why you think that medical students have an important role in having these conversations. And in having these conversations, we have the opportunity to represent not just our fellow medical students, but also our future patients as well. So if you have any questions, throw them in the chat. Would love to answer them. And I have to say, in this worksheet, we included my email. So if you want any help getting set up with a meeting, if you want any help getting set up with an appointment, just reach out to me and I will support you in every way that I can. So with that, only 4 minutes left. I will break off. So looking forward to all of your emails.
Thank you so much for walking us through that, Maddie. As you were going through it, part of me was thinking, I wonder what Justin and Brian think of this. But feel free if you feel like you have any constructive criticism to offer us there. But for everyone here, you know, especially if you, it seems like at least half of you have conducted visits with the offices of your elected officials before. One of the key things that we're trying to get at is to touch upon some of those best practices. So, you know, earlier Brian had talked about, and Justin mentioned also, like knowing how the lay of the land, how the game works. That means doing a lot of homework and doing research. That's some of the issues that we, some of the guidelines that we provided that we want to emphasize. Having an effective pitch, and while we provided some of the data-driven statistics there as well, more effective than that are the personal stories that Brian was referencing before. or that some of advocates will sometimes do at Rise, and sharing their personal stories as well. And making sure that you're being as helpful and useful as possible. That's why we put some of those guidelines in that document as well. And we also included some language for follow-up, and really looking for some of that value add. Some of you might be wondering, why this time around we're keeping things a bit flexible as opposed to having a very directed action towards a particular bill or towards some specific regulatory action. And the reason for that is, well, one, there's a lot going on, and there's going to be a lot of different priorities that we're going to be important to us or we're going to focus on. But two, also, that in anticipation for the new Congress starting post-January, now might be a good time, and especially going into the next couple of months, to start to develop those relationships. So when it comes time for being able to provide any help or use to your representatives or to your offices, that you might be in a position to do so, or to advance some of the priorities that are important to us. Currently, I think Congress is in session till the 21st of this month. So for anyone who is looking to jump ahead,
or longer, we don't know.
Yeah. So for anyone who wants to jump right in, it is in session, so feel free to do that. But for anyone who wants to use this time to organize people at your schools, then you can get ready to prepare for those meetings come this January. And like Maddie was mentioning, both Maddie and myself, we're both available. We're willing to get on calls with you to figure out how we can set up meetings with you. We'll even attend those meetings with you, and to help you walk through this process, ultimately for the vision of trying to have as many people engaged as possible across the country. So with that, I don't see any questions here, but being respectful of everyone's time, I do want to thank you all once again for joining us here on this Thursday evening. Thank you so much, Justin and Brian, for joining us here and sharing your incredible insight with us. I was taking notes. We're gonna send this out and talk about some of these best practices with everyone. And with that, we'll